All right, today we are jumping into one of those really high-stakes diagnostic challenges. You know, the kind where getting it right saves a patient's entire nervous system, but getting it wrong, well, that can lead to some seriously irreversible damage. Welcome to the B12 and folate trap. And look, that is not an exaggeration. The stakes here are incredibly high. This isn't just some academic exercise about fixing blood counts. We're talking about literally protecting the spinal cord. If you misunderstand this relationship, the neurological consequences can be absolutely devastating. Okay, before we dive in, just the usual but very important heads up. All this content is for educational purposes, especially if you're studying for international medical exams. It is definitely not a substitute for real professional medical advice. So, what's really going on here at the core of the problem? I want you to think of your bone marrow as this massive, bustling DNA factory. It's working 24/7, just churning out new red blood cells. But this factory has a critical supply chain issue. It absolutely needs vitamin B12 and folate to synthesize DNA. If you take one of those away, the entire production line just grinds to a halt. And that's exactly what macrocytic anemia is. The factory floor stalls out. The cell's cytoplasm, it just keeps growing and growing, getting bigger and bigger. But because that DNA synthesis has failed, the cell can't divide. So what's the result? You get these abnormally large, bloated, and pretty ineffective red blood cells. And we measure that as a mean corpuscular volume, or MCV, of over 100. Okay, so how do you actually tackle this? What's the game plan? Well, it all starts with this single lab value. That MCV greater than 100. That's your first alarm bell. Your next non-negotiable step is to order a peripheral blood smear. And what are you looking for? There's one classic telltale sign: hypersegmented neutrophils. Seeing those confirms it. The DNA factory is officially broken. This whole picture is what we call megaloblastic anemia. And right here, this is where we hit the crossroads. This is that dangerous dilemma that honestly trips up so many people. You know for sure that the DNA factory is down. But now you have to figure out which specific part is missing. Is it B12 or is it folate? So you get that classic board question, right? A patient's MCV is 110. You do the smart thing, you order the folate levels, and they both come back borderline low. It's totally ambiguous. Now, a really common mistake is to just say, I'll give them both and call it a day. But listen, guessing here is not a strategy. It is a massive gamble with your patient's neurological future. When you're stuck in that gray area, you need a tiebreaker. You've got to call in the final judge. And luckily, there's a specific lab test that will give you that definitive, clear-cut answer you need. And that judge comes in the form of two key lab tests: homocysteine and methylmalonic acid, or MMA. Now look at the table. Both B12 and folate deficiency will cause elevated homocysteine, so that's not going to help you tell them apart. But look at the MMA column. That's the whole story. Only B12 deficiency causes an elevated MMA. That is your golden ticket, your definitive tiebreaker. So why is MMA the magic bullet here? Well, it all comes down to biochemistry. B12 is a crucial helper for the enzyme that gets rid of MMA. So if B12 is missing, MMA just starts to pile up. And this is the most important part. An elevated MMA doesn't just point to a B12 problem, it's a direct biochemical alarm bell that the very pathways that protect the nervous system are failing. It's your nerve guard indicator, and it's flashing red. Okay, this next part is maybe the single most important takeaway from this whole explainer. We need to talk about a hidden, dangerous trap called the folate mask. Understanding this is absolutely non-negotiable. So let's really think about this. Let's play out that dangerous scenario. The levels were borderline, you weren't sure, so you decided to give the patient some folate thinking, hey, I'm covering my bases. What happens next? And this right here is the trap in a nutshell. On the one hand, the blood work. It looks better. Giving folate actually provides a temporary little patch for DNA synthesis. The anemia gets better, the MCV might even go back to normal. You're thinking, great, I fixed it. But you haven't. You've just hidden the problem. Because meanwhile, on the neurologic side, you haven't done anything to fix the B12 deficiency, which is essential for making myelin. So while the blood smear is looking better, the spinal cord is actively, silently degenerating. You've masked the problem while the real damage just gets worse. And that damage has a name, and it's as serious as it sounds: subacute combined degeneration. It is the literal destruction of the myelin sheath in the spinal cord. It targets the posterior columns and the corticospinal tracts. And that leads to those classic neurological signs, like losing your sense of vibration and position. And the most terrifying part? This damage can be permanent. Okay, we've gone through the why and the what if. Now let's lock this down. Quick review, rapid fire style. Let's make sure this stuff sticks. First up, you see hypersegmented neutrophils on a smear. What does that scream at you? Boom! DNA factory failure, megaloblastic anemia. The assembly line is down. All right, next one. Your labs are back. Homocysteine is high, but the MMA is totally normal. What is it?
That is a slam dunk folate deficiency. Why? Because that nerve guard, the MMA, is quiet. The problem is just folate.
Okay, last one, and this is the big one. What if both homocysteine and MMA are through the roof? That is B12 deficiency. No question about it. The alarms are blaring. That is the one signal you absolutely cannot afford to miss. And, just to round things out, it's worth remembering that not every big red blood cell means B12 or folate is the issue. Keep other common causes on your radar, things like liver disease or alcoholism. They can also raise the MCV, but you typically won't see those hypersegmented neutrophils. So there you have it. You now know how to spot a failing DNA factory, and more importantly, how to sidestep that dangerous B12 and folate trap. But it kind of begs a new question, doesn't it? What happens when the cells are made perfectly fine, but then they get hunted down and destroyed out in the circulation? Well, that's a whole different kind of diagnostic storm.